Hello, everyone, and welcome back or welcome to this session at the ISNTD Festival 2022, where we'll be taking a closer look at some really exciting innovation in digital approaches to healthcare education for healthcare professionals, but also for the wider public. And we've heard a lot throughout the day, this very consistent message about bridging the gaps between the global north, the global south, driving a much more equity and inclusion in global health and in science communication. And it seems that, as always, as time immemorial, boosting education is really the great leveler here. And so particularly post-COVID, post-pandemic, when the whole world seems to have jumped online, really harnessing and adopting online digital approaches to healthcare education really seems like the way forward. And so it's our huge pleasure and immense honor, actually, to bring together this afternoon some very big players in this field with some really exciting approaches. And I hope that you will find them not only interesting, but that you will really be inspired to go and take some of these courses and embrace some of these new educational materials, whatever your background or your field may be. I think we've got this covered amongst all the speakers, from dengue to waterborne infectious diseases, and then to all the myriad of other topics that come under the umbrella of the WHO. So I'm really looking forward to this session, and thank you so much for joining us. Our panelists, our wonderful panelists, are here on screen with me. And I'll just say a very quick hello. We're delighted to welcome to talk to us about their work. First and foremost, Heini Utunen. Heini, hello. Thanks for joining us, Heini. You are head of the Learning and Capacity Development Unit at the World Health Organization, and which come under the umbrella of which comes the OpenWHO resource, a wonderful bank, free and completely accessible courses on all things health related. So thank you for joining us. We will also be hearing from Clemens Müller. Hi, Clemens. Clemens, hi. You are Global Medical Education and Training Lead at Takeda, covering the iChagas app and bringing us a lot of insight into what can be done to boost the understanding and the knowledge and ultimately the treatment of Chagas in marginalized populations. We've got Dr. Colin Forsyth from the DNDI, the Drugs for Neglected Diseases Initiative. Welcome, Colin.
Thanks, Marianne. Hi, everyone.
And joining us from the Institut Pasteur's Education Department, I'm also very honored to welcome Clémentine Schilte and Dominique Franco. Welcome very, very warmly to this panel. So at this point, I'm happy to hand over to you, Heini, and please thank you for opening this session for us.
My pleasure. Thank you, Marianne, and really nice to be here in this festival. Delighted to present our learning resources for health emergencies, but beyond, including also the neglected tropical disease resources that we have on World Health Organization's Health Emergencies Learning Platform, OpenWHO.org. You see the internet link here. So this is an open source online platform that we launched 5 years ago in an anticipation of a pandemic. And we equipped the platform so that it could suit any type of a learning response during the, if a pandemic would happen. And so roughly 2 years ago, when first signs of the novel respiratory virus emerged, we were actually well equipped to run the learning response to COVID-19 and what then turned into a global scale pandemic. But along with the COVID-19 topics, we do also cover other health topics, such as the NTDs. And this is what I'm going to present today. on behalf of the talented team that we have on OpenWHO team, but also the neglected tropical diseases team and the collaboration we have with Albis Gabrielli and others from the NTD teams in WHO. So this platform we host is adjusted for low bandwidth, self-paced knowledge components. So our usual courses are about 2 hours, and they really convey the first element of knowledge in certain diseases. In the diseases that we host, we have about 30 different diseases, 13 neglected tropical diseases, and all materials are accessible in multi-formats, multi-channel, from tablets to desktops to mobiles, and everything is downloadable and offline usable. And with this, we've been able to respond to these various health events, such as Ebola, plague, and others, but equally then produce learning resources for these longer-term programmatic challenges, in particular in Global South. And this is why also the NTD's team started producing resources for OpenWHO. Currently, this learning platform hosts about 6.5 million enrollments across 145 or 144 courses, of which we have 44 COVID-19 topics. And about half of our learners actually go out from the platform with the certificate of completion. So we have very high completion rates. So our learners are really committed in completing the courses. We have in total 64 languages on the platform now, varying from Swahili to Lingala, from 3 different languages in Myanmar to many others. And so far we've translated more than 11 million words. We also recently launched the digital badges that learners like to post and showcase in their own records and in social media. The pandemic has really brought the biggest use case for us. Since the onset of the pandemic, our use case went steadily up into this 6.5 million now. And we've actually experienced all types of issues in the platform environment, from expediting course materials, turning course topics into online courses in less than 72 hours. But we've also worked with programs in a kind of a longer term course production. So we've done almost everything in this environment around different health topics. And these are the channels, different learning channels that we host. It varies from healthier populations to data gathering, from universal health coverage to integrated disease surveillance and response, all WHO mandated areas and resources. And we always work with the WHO technical teams, so the content teams, science teams, to produce content. And this is really a whole of organization effort to make learning available. As Marianne said during the day, there's been discussions on equity, and we've really noticed that during the past 2 years and more, we've actually noticed that the underrepresented groups, such as 70 plus learners of age, younger than 20 years of age learners, have come in a big crowd to the platform. And at the same time, the low and middle income country use case has really grown into representing 3/4 of our learners. And when we look at the population data, when looking to the per capita enrollments, the small islands are leading our online learning platform enrollments. So in the island of Guam, more than 6% of the whole population of the island, about 150,000 population, have actually taken OpenWHO course. So in all, the leading use case per capita is in the small islands. We are very happy about this. The language accessibility actually makes the most vulnerable access the learning. So this has been really a driving force for us, working together with colleagues and volunteers and Translators Without Borders across the world to produce into these 64 languages. And the multi-use format allows that learning content can be, for instance, the vaccine courses have been there to be able to localize and adjust the content for vaccine deployments, for instance. This is just a snapshot of the languages we host. There are many of them more to come. We're constantly producing new learning content in different languages, including for the NTDs. And we are serving countries in their country-specific languages. So Somalia, Ukrainian, different Surinamese, other languages have their specific learning spaces where we help countries host their learning content in their own language in their dedicated sites. This has also been welcomed by many of the country offices. It's about 1.5 years ago that we launched the first NTD course that was on NTDs and the COVID-19 course. That is one of the most popular NTD courses. So what is the impact of the COVID-19 to the NTDs? And the latest course that we just launched a few weeks back is a course on safety in administering medicines for neglected tropical diseases. These are all technical team produced resources that then are produced and published by our team and made available for the world. We actually have 13 courses now and about 9 more. Currently, I think it's 9 courses in active production, going to be soon launched. And here are the few of the courses that you see the names of. These were the latest launched courses. And as said, these are short knowledge components, introductory courses for these diseases, for anybody who desires to receive them, basic information. This will not make, the courses we host will not make anybody professional in the NTDs, but it can provide the first knowledge component in the journey to understand and initiate the work on NTDs. The courses have about 50,000 users. Most of them, I will show later, are actually students and health professionals. So the use case is very varied. Here are the courses as we have them. We've added many more courses in the latest months. Here also an overview of the courses we have, and also the language production that we are currently undertaking. All of the courses we host, we are producing into those languages that our regional and country offices or partners we work with determine as needed, and often start with the UN official languages and then go into more localized language offerings, with particular emphasis, of course, on African languages. We host currently 15 different African languages. More of those course offerings. I see we have some overlapping courses with other colleagues who are presenting here today. A few more of these courses. And then just on the use case. So students, as said, students and healthcare professionals are the highest users among our learners on NTD courses. We also have volunteers, ministry and health expertise in the background of the learners, and the younger populations between the age of 20 to 29 and from 30 to 39 are actually the biggest bulk of users on NTD courses, and men slightly more among the course users than women, but we've actually increased the number of female learners over the pandemic significantly. On the whole of platform, more women are now among the learners than men. It has changed over the pandemic. Here are the top courses, the top countries of the courses. So India is leading in all of our courses, I would say. All courses are mostly used in India, where the online learning has been really popular for 20 years already. China is a very large user of our courses. So is USA. These are also big populations. Then Nigeria, Pakistan, Ecuador, Philippines, Mexico, Azerbaijan, Kenya. So mainly middle income countries here in the kind of a larger use case. But as you see from the heat map, our NTD cause use cases from all over the world, including from the small islands, which is very important. And here's our contact information, and invite you to go and log in to openwho.org and also give feedback on what do you think, how these courses work for the purpose, and feel free to multiply and share the resources. Happy to answer also questions, any questions that might come. For us, learning is really to save lives, and we believe that also with the NTD courses we are saving lives. So thanks a lot for your attention, and happy to respond to any questions.
I know this is a great way to end your presentation and start this session. Learning is really saving lives, and in particular, this level of detail and analysis about who's accessing the courses and how, I'm sure will be really invaluable to more and more organizations who are trying to embark on this learning and education journey, whether it be with kind of the broader public or affected persons, or kind of very small and targeted communities. So a huge thank you for that to Heini and the team. So thank you so much from us all for setting the scene so clearly and so inspirationally. And you've definitely made me become more firm about my resolutions to work my way through those many WHO courses. Thank you.
Thanks, Marianne. And I'll stay online here for about half an hour or so, and then attend to some brain-related works. But really nice to have joined and learned of this great resource that the ISN NTDs provide. Many thanks.
We thank you. Thank you so much. Okay, I think this is a great time to now hone in a little bit more and focus more specifically on one of the diseases, namely dengue. I'd like to call Clémentine Muller to the floor. Hi, Clémentine. And we're really excited to hear more about how and why and in which manner and what the future holds when a big pharma kind of comes into this space. We're very excited to hear about your two portals, No Dengue, as well as the Dengue Academy. So without any further delay, I'll hand over to you. And thank you so much.
Thanks, Marianne, and thanks also for the invitation. And you already somehow steal the thunder to present at the end the Dengue Academy and the No Dengue. So, but exactly that's what I would like to present. As you can see in the title, Innovative Educational Approaches in Dengue. So I will now focus really on a specific disease. I think it was really impressive what Heini presented in terms of solutions provided by the WHO on plenty of tropical diseases with different languages. So in my presentation, the focus is on a specific disease, dengue. And I would like to start my presentation with a quote by Herbert Spencer. The great aim of education is not knowledge, but action. I think that's really important. Of course, we are talking about getting the knowledge, gaining knowledge, getting familiar with specific topics, learning more. But I think that's also then essential to transfer this knowledge into actions in a daily life to support the health. And I think this is also some kind of a framework I would like to give, not only to gain the knowledge, but then also taking actions. But what is dengue? So dengue is a common mosquito-borne viral disease, and it is endemic in more than 125 countries. And as you can see also here on the map, with the highest disease burden reported in the Americas, Southeast Asia, and the Western Pacific region. Dengue also has the greatest disease burden of any mosquito-borne virus, and the second of any mosquito-borne disease following malaria, as you can see here by this graph of the data reported of annual numbers provided by the WHO. And I think what is also important is that dengue is really the fastest spreading vector-borne viral disease worldwide. There's a 8-fold increase in the in dengue cases over the past 20 years. And epidemics are really unpredictable and are being increasingly frequent. With the capability to also have a to also have a spreading in previously unaffected areas, and that is basically also due to the global warming. And we also see a prediction in terms of incidences in the future with a much higher increase of those cases. And that's basically due to several factors. It's like including urbanization and population growth in the endemic regions where dengue is already endemic, the continued expansion of the mosquito of the Aedes mosquito vector, but also that's also in the response of the climate change, an increased travel, domestic, international travels, and also some kind of an ineffective vector control method. So there are several factors which already shows that it's clearly there will be a higher increase or will be increase of dengue cases also in the future. If we have a look on the education itself, on the know-how, the knowledge, what I also mentioned at the beginning with the quote, knowledge is still important, and I have selected here some latest research in both fields, the HCP education as well as in the public education. You can clearly see there is a gap of knowledge, or there is some kind of a significant gap of specific areas, which also has a huge impact at the end on how to deal with dengue for both HCPs, but as well as public education, public awareness. And as you can see also in this, in the middle, the research by OpenWHO colleagues, this is also affecting really developing and underdeveloped countries with limited health resources to build this capability around dengue, the disease, the management, the treatment, the prevention, and at the end also the control of it. What are the, let's say, the behaviors of learning for HCPs on the left side as well as for the public on the right side? And I think that's nothing new. I think this is quite clear, and also Heini mentioned this in the presentation about the WHO approaches. We are going more and more in a digital transformations. HCPs are getting more digital natives. And we also do know that HCPs, the biggest burden in terms of learning is the lack of time. So they are really searching for website, digital content, bite-sized content, really, to get information as easy as possible. For the public, you can see also some kind of a similar picture that the internet is really as one essential tool to learn more about the disease, to get more information, to get familiarized with this disease of dengue, but also all other diseases. And according also to the WHO, these digital information and communication technologies play really an essential role in terms of prevention of diseases. So what I would like to introduce you today is based on this really high global burden of dengue, this educational gap for both the HCPs and the publications, but also these behavioral changes in HCPs and the digital adaptations, 3 solutions. On the left side, you see an open access website, the Dengue Academy, aiming for the HCPs. And maybe you can already realize and recognize a little bit the style of the website. It looks pretty similar to Netflix. It's really like with carousels, easy accessible content materials where the HCP get immediately access, and we keep the burden of accessing information, content, and knowledge pretty low. On the right side, another website facing the public called No Dengue, really to inform, educate, and create awareness in the public space. And in the middle, also a video clip, which we have recently produced, also to support the public area to get more awareness about dengue. Diving into more these 3 solutions, the Dengue Academy, you can also see here the URL. And it is really like it's getting the knowledge, but also the action to help fight against dengue. And the The Dengue Academy itself consists of several materials with several formats. So on the left upper corner, you see we do have a large library of short video clips, bite-sized, 3, 4, 5 minutes about dengue, about the vectors, about the disease itself, about how to deal with dengue, case management, epidemiology, etc., etc. On the right upper corner, you also see that we are providing an overview of really relevant events and meetings according to this field. So produced and hosted by medical societies and other educational providers. So it's some kind of a go-to platform to learn more and also to get knowledge also from others. On the left bottom corner, you also see these publication summaries of articles about dengue. It's really in a bite-sized format, a short summary of specific publications to learn more about the disease. And again, this is purely focusing on the HCPs. So also the language as well as the material with a certain scientific and medical framework. On the right bottom corner, you'll see additional items, additional materials, what we are providing on the Dengue Academy, CME courses, key opinion leader talks, recordings from webinars from medical societies or educational providers like Medscape. So to really have this platform as a go-to portal for the HCPs to learn more about dengue, the disease, and educate themselves as well. The second part, as I mentioned, the No Dengue website, also with the URL, which is visible, is in contrast to the Dengue Academy, really focusing on the public area, so that everyone globally will get access about information around dengue. And it is also in a way, in a format, of course, with less scientific content and less medical content, also to keep the understanding as high as possible. We have more or less 3 main areas within the Dengue Academy. It's on the one side, what you can see on the left, know the risks or know the symptoms. So where you as a user can really select some artificially created cases with different symptoms, clicking through them and then really getting an understanding, what are the symptoms of dengue, and in this specific case, what we have selected here on the left side, if the girl Adriana, 8 years old, really has dengue, and what are the next action items. On the middle, know the numbers. It's about epidemiological data, not only from today, also the last years of specific countries where dengue is really endemic. But it's not only the dengue incidence, it's also the weather, the temperature, the rainfall average, etc. So additional factors which play a role also in terms of dengue. And on the right side, of course, what we also provide is really like a rich library of specific articles on specific topics which are supporting the understanding, the educational aspect to learn more about dengue. As I said, always in a writing style which should then also fit in terms of understanding. Another element is a video clip which we have recently launched and which will be available on social media. It's called Get the Dengue Game Plan. And the easiest way is now to run this video. I will deselect the voice of the video and I will explain the video a little bit. Otherwise, it's hearing 2 voices. It's a little bit confusing. But that's really like this public-facing video, and it starts with some unrealistic scenarios, like an asteroid is falling on you. So it's really like, look, there are so lots of dangerous situations which could happen. As I said, more in an unrealistic way. The technology is getting angry and is impacting you. Aiming then towards the dengue virus and the Aedes aegypti mosquito, that this is really a case what is existing and what is really like a threat, which might be at places where you don't really expect it on different scenarios, that it can also affect everyone, really everyone, the whole society, and that you should get really then advice from your doctor what to do, what to consider if you are at risk in order to protect you, but then also your whole family. And I think that is really the main message. And it's really like a simple and effective communication. It will be available on social media, really also not only with the knowledge, but also this action item, really then to seek advice from the doctor, to learn more from the healthcare professionals, that if you are feeling that you are under risk. So my takeaway message, my key messages for my presentation is really that we are really committed to support dengue, the dengue community, providing those resources, the different websites, the different materials, and that's only like a snapshot of digital assets we are providing. So really the call for action from my side would be check out the website, check out the video, share this with your network, so that we can ensure really not only gaining knowledge, but also action.
Thank you so very much, Clemens. I think when you think about an educational portal on dengue, some of us might assume it could be on the dry side, it being such a highly complex scientific kind of ecosystem of issues, but you've called it the Netflix of dengue. I mean, that is totally, that is, very, very appealing. And also this kind of gamification, the game plan of dengue as well. So definitely it's got this huge potential to appeal to a large audience, whilst at the same time retaining those all-important goals, as you so rightly explained right at the start, not just of education, but of really action. So doing something to tackle dengue. So thank you so much. This was a wonderful example, very inspiring. And I think we've all heard loud and clear your call to action, to check out the resource, but also to share it widely to anybody who might be interested, either from a healthcare perspective or quite simply from living in those numerous affected and at-risk areas across the world. So thank you, Clemens. That was really exciting.
Thanks.
Thanks so much.
I will be available for some questions at the end.
Fantastic. Yeah, we'll all come back together and have a good discussion, no doubt. Before that moment, we're just going to hop diseases now and move on to Chagas. So Colin, thank you for joining us. And we're ready to hear all about the iChagas app that was recently launched by DNDi. Thank you for joining us.
Thanks, Marianne, and thank you for the invitation. It's a pleasure to be part of this event. I'm going to move to another insect-borne disease, Chagas disease, and talk about the recently developed iChagas app. And just to introduce our organization, I'm with the Drugs for Neglected Diseases Initiative, and we are a nonprofit whose goal is to develop urgently needed treatments for neglected patients, focusing in particular on gaps for neglected diseases and viral diseases that are concentrated among vulnerable populations in resource-limited settings. So Chagas disease has been a priority area for DNDi since its founding. And to give an idea of some of the challenges we're facing in Chagas disease, the current treatments that we have available against the parasite were developed over 50 years ago. And they're associated with a lot of problems, including side effects. And there's also a huge diagnostic barrier in that, really a small percentage of the estimated people with the disease are actually able to move on and get a diagnosis so that they can initiate treatment. So in addition to working on new treatments for the disease, one of the things that DNDi began working on in 2015 is developing a program to improve access to diagnosis and treatment. And with partners in Colombia, we have piloted a simplified model of a test and treat project to help give access to patients to testing and then to the best treatments that are currently available in the health system. And so really, you know, one of the main barriers that we faced is that both in the community, but also among healthcare providers, awareness of Chagas disease is very low. And so one of the main focuses of our access program has been on increasing healthcare provider awareness so as to increase demand for, and so the Chagas app that we've developed fits nicely into that objective. And to quickly give you some background, you know, there's an estimated 6 million people living with Chagas disease across the world. Most are concentrated in Latin America. There's an additional 75 million people at risk of getting the disease. And about 30% of people with the infection will eventually develop either severe cardiac complications or other major organ complications. And this is why it's very important to stimulate provider-driven screening so that patients can be identified early, considering that most people don't know that they have the infection. So the DNDi Chagas mobile app is a tool to help address Chagas disease, a major public health challenge in Latin America. And as I've stated, low knowledge, really low awareness about Chagas disease among healthcare personnel is one of the major barriers that we're facing. So the hope was that creating an information consultation tool, this app, would be one thing that can help providers become more aware of and have quick access to knowledge about testing and treatment for Chagas disease. So the objective of the app is to provide medical and scientific training on how to diagnose and treat the disease, give easy access to general and publicly available information about the disease, and clinical practice. And the app is really focused on the comprehensive care of Chagas disease, so treating, you know, acute and chronic phases and dealing with prevention as well. It's meant to be a training tool and not a decision-making tool. And it's also not a tool for collecting medical data from patients or from healthcare personnel. So the only data that we collect from the app is just what's collected through the registration process. So what we consider the key features and advantages of the app, it's designed to be very user-friendly. It's available both for Android and Apple. It can easily update and renew information, and kind of associated with that, the app is available to work online but also offline. Considering a lot of the healthcare personnel who work on Chagas disease may need to go to more remote areas as part of mobile clinics, for example. And so the app has the capability to be used even if there's no network connection available. It was also designed to have low technical demands. So this means that we don't have videos on the app just in order to make the space requirements lower and easier to use. But it is adapted for the availability of, for example, flow charts, figures, images, tables, and so forth. Right now, the app is available in Spanish only. It's something that could be translated to Portuguese and English. There's no technical challenges to that, and we hope to achieve that in the future. We're just looking to identify the right source of funding to make that possible. So again, the app is not considered as a medical device, and this was just important for registration purposes. It's a medical information tool, and when you first download the app, you know, the first thing that comes up is the data management policy, which just indicates the only data we collect is from the registration process, and a liability statement indicating, you know, it does not replace the existing medical guidelines where healthcare providers are working, and it certainly does not replace the clinician's best judgment. It's just meant as an information resource. Well, this was sort of the process that was followed for developing the app, something that we'd thought about doing for several years. We signed a contract with a technical company to develop the app back in 2020. The project for developing it took 16 months. Basically, 330 pages of text were assembled as to include in the app, and 371 images. There's also maps. Technical review takes place twice a year to ensure that the content is up to date. And just to emphasize that, the basic foundation of the information that is in the app is from the diagnosis and treatment guidelines for Chagas disease put forth by WHO and POHO in 2018. This slide just sort of explains the different modules that you can access through the app. So starting with the epidemiology of the disease, transmission, how to diagnose T. cruzi infection, etiological treatment, congenital Chagas, oral transmission of Chagas disease, and then special cases, HIV, co-infection, and other immunosuppressive conditions, treatment of Chagas heart disease, and digestive complications, which is one of the other major chronic complications. There's a module on sort of engagement with the community and community perspectives, policies, regulations, and advocacy, primary prevention, so considerations from entomology, and finally considerations on reading electrocardiogram for Chagas disease, and then finally the participants and the credits. And this was just sort of the data sheet that was prepared with all of the technical specifications to submit to regulatory authorities. And then, so this was submitted in Colombia for regulatory approval because the technical company that worked on the app was a Colombian company. This is just a slide showing all of the different people who came together to contribute to the app. And just to have full transparency, I was not involved in the creation of the app, but I'm speaking on behalf of my colleagues on the Chagas team. So down, if you look at the bottom row, Andrea Marchiol was really the person who coordinated the project and brought it together with lots of help from Rafael Arazo, and then Sergio Sosastani, who was head of Chagas program at the time that the app was being developed. Also, lots of other team members from D&DI contributed, and then I'm sorry, I didn't mean to. The top row is, and most of the middle row is mostly people from partner organizations who gave their time in order to provide content for the different modules of the app. So don't have time to go into everybody individually, but just a big thank you to everybody who came together. It was really a collaborative project. And of course, our main thanks are to the people working on the ground and the people who are affected by Chagas disease. Well, the app was just launched on World NTD Day on January 31st, so it's still fairly new. And really what we're working on now is just getting the word out so that more healthcare providers know about it and can have access to it. But here you can see the countries where the app has been downloaded. And so far we've had close to 200 downloads, and you can see the professional profiles of the people who have downloaded so far. Big proportion are about 30% are medical doctors and 6% nurses, 10% people working in public health. And anybody who is interested in the app, you can go to the App Store, for example, right now, and it's a free download, and it's an easy download. So this concludes my portion of the presentation, but I'd like to just share a short video that we developed to publicize the app, and we'll see how this works.
Hola, bienvenidos a la aplicación iChagas de la DNDi, una aplicación para dispositivos móviles con información actualizada sobre la enfermedad de Chagas, diseñada para apoyar al personal de salud de una manera sencilla y didáctica. Gratis, de fácil acceso, la aplicación iChagas es compatible con los sistemas Android y iOS y se puede utilizar incluso cuando no está conectada a la Internet. La enfermedad de Chagas es silenciosa y por eso muchas personas infectadas desconocen su condición. La falta de información sobre la enfermedad entre los profesionales de la salud constituye una barrera importante para el acceso al diagnóstico y tratamiento oportuno de la enfermedad. Actualmente, menos del 10% de las personas con Chagas en las Américas son diagnosticadas y solo alrededor del 1% recibe tratamiento antiparasitario específico, lo que convierte al Chagas en un problema de salud pública. Por eso, la DNDi, junto a expertos en el tema de la salud de países endémicos, desarrolló iChagas, una herramienta para compartir y difundir conocimiento. La aplicación cuenta con módulos en los que es posible conocer las características de la enfermedad, sus manifestaciones clínicas y cómo se diagnostica y trata. También hay datos sobre prevención, asociaciones de pacientes, lecturas de electrocardiograma, mapas, indicadores demográficos y mucho más. La aplicación también incluye acciones de políticas públicas regionales, nacionales e internacionales, así como lineamientos, consensos y guías de atención de diferentes países. También es posible consultar las resoluciones de la OPS, OMS y de otras organizaciones de salud. Todo esto disponible estés donde estés. La información científica es nuestro mayor aliado. Es por eso que la DNDi, una organización de investigación sin fines de lucro, que desarrolla nuevos tratamientos para poblaciones desatendidas, se alía con las nuevas tecnologías y busca brindarle a usted, profesional de la salud, toda la información disponible para la atención de las personas afectadas por la enfermedad de Chagas. Este es el compromiso de la DNDi, llevar la mejor ciencia a los más desatendidos.
So hopefully everybody was able to read the subtitles okay. Again, the video, I should explain beforehand, is in Spanish because specifically the audience that we really want to get involved in downloading the app are healthcare professionals in Latin American countries. But that concludes my presentation, and happy to answer any questions at the end of the session.
Colin, thank you so much. That was just to confirm, yes, we could definitely see the subtitles. So thank you for that video. That was great. And also it was really interesting, in addition to and building on what we heard earlier on in the session, to get a bit of an insight into all the additional kind of administrative steps and the regulatory issues and all the things you have to think about really when in practice deploying an app or an education tool. And perhaps these are some of the things that we can discuss a bit later. But thank you so much for that. And I'm sure that many colleagues working on lots of other diseases amongst the myriad of neglected tropical diseases will find a lot to learn from that. Thanks, Colin. And so now we'll move to our final tandem of speakers for the session, and namely from the Institut Pasteur. We're going to be hearing a lot more about not just waterborne infectious diseases, but also the other subjects and diseases covered by the education department. I'll hand over to Clémentine Schilte and Dominique Franco. You're both scientists and at the same time also heading the delivery of Institut Pasteur's MOOCs. So a very exciting time to be combining the forces of these two fields, one namely a world-famous research institute into infectious diseases, and on the other hand, kind of moving into this very open and outward-looking educational platform and those approaches. So I'll hand over.
So we're going to present together with Dominique Franco. So Dominique Franco is a former digital education head at Institut Pasteur, and now I'm replacing him, and he's an advisor for us. And I would like to present to you the different MOOC we have developed so far. So, as mentioned, I will present together with Dominique Franco. And so, first of all, I would like to tell you about the 4 historical missions of Institut Pasteur, which are research, public health, education, and technological transfer. And furthermore, the Institut Pasteur is not only Institut Pasteur in Paris, but also a network of Institut Pasteur around the world. And there are 32 institutes in 26 countries on the 5 continents. And here are the different MOOCs we have developed so far. So we started in 2015 with Dominique. And so here are the 16 MOOCs on infectious disease that we have. And there is also the possibility, if you validate 5 of them, to obtain an Institut Pasteur online diploma for infectious diseases. So you could see that we have one on vaccinology, innate immunity, medical entomology, but I will let you read the whole content on all our MOOCs. We also have other MOOCs on other topics like epigenetic and human population, and stem cells and microbes and brain, or neuron and behavior. Our MOOC are broadcasted on France Université Numérique, which is a French online platform for MOOCs. And they are only online for 2 months, but once you register, you can always have access to the video. So I highly encourage you to register for the MOOCs. And there is always a community manager for our MOOCs. They are free to follow, but then if you need to have the exam, it would cost 150 euros. They are all in English with French subtitles, and they are rebroadcasted every 2 years. And we've developed most of them with the support of Foundation Ipsen from 2019 till 2022. And concerning our audience, we have mostly Bachelor of Science in Biology, PharmD, and MD. And as you can see, the medium audience is about 3,800 learners, but it varies a lot between 1,000 and 6,000. And we have participants from all over the world. And this is, for example, the audience of the MOOC Medical Mycology, where we target 166 countries around the world. And so now I will let the floor to Dominique. Dominique? We don't hear you. So you don't hesitate to put your camera or your microphone. Otherwise, I will start. So Dominique has worked on a MOOC on waterborne infectious disease. It's a major public health issue, as you may know, as you should know. And so there are 2 billion people who do not have access to safe drinking water. And a lot of people also don't have access to basic hygiene.
This MOOC was just launched on last Tuesday at the beginning of the World Water Forum. And why do we do that MOOC on waterborne infectious diseases? Because it's a major public health issue, and this has been underlined by WHO, and it's a One Health problem, which is a very important problem. So, as Clémentine said, more than 2 billion people do not have access to safe drinking water, do not have access to proper toilets, and do not have access to hygiene, to basic hygiene. And why? Because fresh water is now contaminated by many microbes, particularly in developing countries, bacteria, virus, parasites, and those are responsible for many severe infectious diseases and deaths. So the goal of this book was to make knowledge on waterborne infectious disease easily available worldwide. And we did this book with the help of a major company engaged on water supply and waste disposal. This is the foundation Veolia. And they not only they give us financing to do the MOOC, but many ideas about how to set up this problem of waterborne infectious diseases. And with this book, we want to help population with online education. So the objectives of the MOOC on waterborne infectious diseases were first to have a global positioning of freshwater contamination. Why does it happen? How does it happen? With specificities of contamination in different continents. Two, to see the main bacterial, viral, parasitic, and vector-borne transmitted diseases. There are a lot of them, so you could only study 16 of those diseases, but the most important of them. And three, how to prevent and adapt corrective measures to avoid these waterborne infectious diseases. And you will see a word which is very important. It's an intersectoral work. So first, how and why the fresh water becomes contaminated with so many microbes. And there are two chapters. The first is a general consideration on contamination of water, which is due usually to overpopulation, to the vicinity between toilets and water sources. This is what we call the fecal peril, due to the vicinity between livestock and water sources, and to the lack of equipment. Besides those general considerations, there are a lot of regional features which increases the risk of water contamination, and we ask on the field people from the Pasteur network to work on these regional considerations, people from Senegal on the living conditions, people from Madagascar on the role of watersheds and erosions on the risk of contamination of the water. Somebody from Cayenne and Guyana. Guyana is the French Guyana is a very important country in terms of water resources, and still the importance of rainfalls is great in developing the risk of contamination. A very important problem is the problem of the Great River Basin, and this was done by Navin Strang from Institut Pasteur of Phnom Penh. When you have a small country downstream from a big river, which has a lot of other countries around, so the small countries downstream get all the contamination from other world countries upstream. And this is a very big problem in many river basins, or in Southeast Asia and also in Africa. And there were a lot of very interesting talks by people from Madagascar on the socio-anthropological considerations in water contamination, customs, habits, perception of water contamination. In Madagascar, people see, they consider the water from the color of the water, and the color change during the dry season and the rainy season. So they believe that the water is still very good, although it is contaminated. So all those are very important considerations. Then we try to expose the main bacterial, viral, parasitic, and waterborne diseases. And I just selected 3 of them in this presentation because they are still very important. First, the cholera, and there is a cholera pandemic. There has been a cholera pandemic for the last 50 years in Africa, in Southeast Asia, in South America. And it's still going on, and it kills a lot of patients, more than 100,000 patients per year. The second one is a rotavirus infection, and rotavirus infection is a source of very hyperacute diarrhea in small children, and it still kills 1.3 million children every year due to this acute diarrhea. And the third one is a parasitic infection. You see, schistosomiasis. Schistosomiasis is still very present in Africa and in Southeast Asia, and also in South America. And it's a very debilitating disease, giving urologic and hepatologic disorders. The last chapter is devoted on prevention and corrective measures. And there are sessions by people from NGOs, and they show how to share the burden of waterborne infectious disease between them. It's not always easy, and they try to do each of them a particular work on that. The role of government is very important, and there is a very nice presentations by Didier Bompang. Didier Bompang is from the University of Kinshasa in the Democratic Republic of Congo, and they launch in the Democratic Republic of Congo, they launch a very important program to eliminate cholera from the country, and it's working now, and they almost got rid of this terrible disease. And the last session is by Thierry Van Vel from the Foundation Veolia. The Foundation Veolia has created the GAC, Global Alliance Against Cholera. And the principle is that it's a very intersectoral work. That means that you have to put around the table populations, city councillors, governments of the province, governments of the state, and companies. And all these people, they have to work together. And it happened that yesterday, at the same time, I was in a small village in the harbor region of Senegal, having discussions with the mayor, with the chief of the ancient of the village, and with the Foundation Veolia, to find out how to collect the waste of the city, which was not done until now, and how to put away the slaughterhouse from the main source of the village. You know, you have to settle small problems to get very important results if you put everyone together. Well, we hope that this MOOC on waterborne infectious diseases will bring affordable information, easily affordable information on the etiologies of freshwater contamination by microbes, on the major waterborne infectious diseases, and on the prevention of freshwater contamination and the need, and this is the very important word, the need for intersectoral work. So this MOOC should show how relevant it is to do MOOC and other types of online courses for education and training in developing countries. To register to this MOOC, you have this link here, and you can also flash this QR code, and it's very easy to get registered and to follow the MOOCs. As Clémentine said, it's free, except if you want to pass the diploma. and it doesn't take too much work to follow the MOOC. So I want to thank you for your attention. We want to thank you for attention, Clémentine and I.
Thank you, fantastic. A wonderful resource to explore, and also what's been really interesting is your collaboration with Foundation Veolia, and also tying this to World Water Day. It's kind of a very innovative and sort of outward-looking way to launch a course, to build a course. So congratulations. It's very interesting, and no doubt this will be very useful to many in our networks and to all of us. And I think that really goes to all the courses and resources that we've heard about today. It's a really exciting time. There was a time where particularly technical education in health or medical issues, but also in water and sanitation, maybe might have come with quite a lot of barriers, whether they be cost or possibility to step away from the workplace for a few weeks or months to complete. And this is really this heralds a very exciting new era in terms of healthcare education. And it's wonderful to have these really huge partners on the call today. There are many more out there, but let's see what the future holds. I think pre-pandemic, post-pandemics definitely marked an inflection point. It's a sector in its infancy, but already has so much to offer. So it's been very exciting hearing from all of you. While we've been talking and listening to your presentations, a few questions have cropped up, but I suppose first and foremost, what I would like to ask all the panelists, and please, by all means, Colin and Clemens, and I believe Heini has had to attend to her meeting at WHO, but if you don't mind to join us, then I suppose my question would be, you've invested already a lot of effort in your platforms. I'm sure there were many hurdles to overcome. And so just based on your personal experience, what were some of the biggest challenges you faced? Or also, if I can flip that onto the other side of that question, what would, looking forward, what would facilitate the next steps in your journey and your work in healthcare education? Perhaps Clemens, we could start with you.
So I think one specific element is really this one size fits all is quite difficult in education, right? So and you need to find the balance between some kind of individual approaches for regions, for different countries, because for all the diseases you have different needs in the different countries. Also language-wise, right? Language is another big topic, right? If you would like to reach globally, language is a big topic. But I think this is some kind of the biggest hurdle, this language issue to serve globally, but also providing materials which covers the need of each country and each region, right? So you need to make some trade-offs if you would like to have a global version. But I think that's the way to go, to have it as individual as possible. And then, of course, there's still the big challenge of finding the right channel to address it really to a wide range. And I think the digital transformation will give some benefits, maybe also some downsides, right? But I think that's the way to evolve and also elaborate what is the best channel to go. And maybe if you ask me in 5 years, I assume there would be completely other channels also reaching out to HCPs, right? So let's see what the future brings. So you always need to be state of the art and cutting edge. So that's the way to go. And I think there's this quite nice statement by an industrial designer who calls it Maya. I think most advanced yet acceptable. That's the way to go. So you need to go for the most advanced, but it needs to be also acceptable by the society, by the public. So Maya, that's the way, and this needs to, that's always different. This is where you need to find out how advanced and fancy you can go, but still keeping the bringing the target audience and the learners on the journey. That would be my statement.
May I ask? May I add something? When we with the MOOCs of Institut Pasteur by the French platform Fun, we reach all African countries except one, Eritrea, which is that's we know why, but we had learners from all countries of all Africa and all countries of South America, including the small islands of the Caribbean, for example. So I think we have the means to reach people. It's not too difficult now.
Yes, I may also add something. So I think the different hurdles for us are first, as a research institution, to really convince researcher to invest energy in teaching. Sometimes it could be we have to put lots of energy ourselves to convince researcher to coordinate with us the MOOC and to find the different people that would be that will take part in the MOOC. And second, it's because of the high level of our MOOC. We are more for people who have a Bachelor of Science. It's difficult to update all of them because now we have 20 different MOOCs, so it's difficulties once you have a high number of MOOCs. But we manage this. And the third difficulty for us, it's also for the platform, because we have so the French France Université Numérique platform is great, and it targets very well the French world, but it's a bit less well known in other countries. So it's true that we have, for example, in our diploma, the first country is first France, but then it's India, and then it's Democratic Republic of Congo. So it's quite strange, but well, it's working even with a French platform targeting the whole world.
If I can comment on the iChagas app, I think the main difficulty in the development process was just that we're an R&D organization. We have a small team working on Chagas disease, and so just kind of finding people to devote time to work on the app was a challenge, and so being able to get external collaboration was very key. I think there was a question about how expensive it was to develop. So that was another challenge, is we didn't have a lot of funding, earmarked for this kind of activity. So we wanted to do something that was very low cost, and some of the keys were just getting, collaborators to participate in the team, but also using a local company in Colombia, which is an endemic country, which is very technically capable. To develop the app was another key to being able to develop successfully. Now I think just the challenge is getting the word out to healthcare providers who are working on Chagas disease. Some people might only need to might come across one patient and at that time need to use the app. So how do we get the word out to people in that situation, and then developing the right indicators to make sure that we're tracking the impact.
Very useful pointers there, thank you, and thanks, Colin, for pointing out Joanna Butler's question about the cost of developing an app, and perhaps that would be my next question. Clémence, you mentioned this great concept, and so I wanted to ask you about the least advanced, most acceptable, llama. And by that I mean, as kind of digital approaches become more and more democratized, we do see these plug and play websites and plug and play apps. And in a way, you could develop an app quite quickly on your own. However, will this least advanced approach be acceptable to the public? I mean, I'm sure we're all guilty of getting annoyed when a web page takes 5 seconds to load instead of 1. And where can we strike a balance? I mean, when you do go online and you look at some of the apps around, I mean, I've seen 16-year-old kids doing, I wouldn't use it, but kind of apps to self-diagnose if you have polio, and quite ambitious projects. So at the same time, you don't want to go too advanced, but how do you balance that? Keeping it simple, keeping costs in check. What advice could you give to someone who perhaps would like to get more involved in developing educational platforms?
Well, I do think there are
and
several.
We can start with you, Clement. So.
Yeah, there are some things you need to consider. One thing is, of course, the user friendliness, the usability of the tool, right? So, as you mentioned, if a user is getting annoyed immediately of don't find the right material immediately, he or she will not come back to this material. That's one part. It's about the use case. The second one is the content, right? It needs to be high quality. And if I say high quality, it doesn't always mean it needs to be high scientific quality. It needs to be the appropriate content in the right terms for the target audience, right? If you would like to talk to HCPs, it needs to be on a higher scientific level. If you talk towards the public, maybe you need to have a different language. So these are the things. Content, quality, user friendliness. And then what I also think it's really important is, like, in this dynamic world we have, also to constantly update materials, right? So it's like if a user realizes, look, it's the same like last month, maybe he will check the next month again. So there needs to be refreshed content all the time, and that's coming back to the challenge. Of course, that's a challenge then of the provider, always updating materials in this fast environment. So these are the elements, the 3 elements I would think: regularly updates, the appropriate content, as well as user-friendly environment.
But I agree with you. You have to adapt the content very frequently because it's moving so fast.
Yeah, I think that can be one of the main challenges. Is, you know, once you create a tool, you know, how do you monitor it? How do you gauge its impact? And totally agree with all of the points you made, Clemens. And not only how you continually monitor it, but how you continually use that information to determine what updates you need, I think is critical.
There was a very good illustration yesterday afternoon. They wanted to buy a big truck, like in the Paris street, to get rid of, and that's completely inadapted because they had no driver. They did not have enough gasoline to fill in the truck. So it's interesting to see how you have to adapt the needs to what you have on the ground. So they will not buy a big truck at the end.
I'm very sorry because my connection dropped out momentarily. So I just want to make sure everyone had a chance to answer the question while I was fumbling with my connection. Thank you. Well, it's been a really fascinating session. I'm afraid we're coming towards the end of our allocated time, and I am very aware, Dominique, you've been traveling, you've been on the go nonstop right until this webinar, and that's really appreciated. And everyone's given up a lot of your time to share with us these incredible approaches and very inspirational. So I just want to thank you for that. And we'll be, of course, sharing all the links to the many resources and platforms and courses. And of course, watching this space. And thank you so much. This is really a very special time, I think, for the healthcare sector, particularly the voracious appetite now amongst kind of global publics for scientific information, with all the good and the bad that comes with it. But a really good time for a bit of introspection on all these issues. And you've given us some really important pointers, whether that be in terms of the content or also the delivery and the partnerships required to bring all these educational projects to fruition. So thank you so very much. And if you have no more final words for us, then perhaps we can bring the session to a close, and definitely keep in touch.
Thanks.
Thank you.
Thank you
Thank
very
you.
much.
Thanks, everybody.
So much, and a very big